ways to coordinate care so that savings, whatever stage someone is in the process of life, to have savings by coordinating care in much more than is done these days. So I guess that's my answer.
Senior citizen line, Key Largo, Florida. Gus, you're on the air.
Hi. I received Social Security disability, and you know, it's hard to do it. I had a helicopter ride from one heart attack, and I'm paying $56 for payment per month on that. But to go back in 1963, when I started working, I was paying $1.65 out of my check for Social Security. And I worked at a private club in the Adirondacks, and I was talking with one of our members, Ambassador Kemper of Kemper Life and Casualty Insurance, one of the structures who helped structure Social Security with Franklin Roosevelt. He says, watch out for future things, what they're going to do with Social Security. And then in 1980, you had Ronald Reagan increase it to 6.2% for employees and employers. He did that to cover the shortfalls which were created by his tax cuts. And also, he never put a, you know, every year where the cap.
Okay, Gus,
would be.
So what's your question?
Well, I just don't like what the Republicans are doing to the Social Security. Why can't there be a automatic index for inflation in the cap from 107,000 to what it should be, 275,000, 300,000.
Okay, we've got your point. Next question.
Yeah, this is a hot topic, as you can imagine. I don't think a lot of people realize that there is a cap on wages subject to the payroll tax. Right now, it has gone up a little bit over time, but it is $106,800. After that amount of income from wages, earned income, there's no more tax on Social Security. I come from Omaha, Nebraska. I grew up in Omaha. And, we have a citizen that's done pretty well of Omaha, Warren Buffett. And I've heard him talk about how he thinks it's unfair that he's paying the same amount into Social Security as his secretary is. And he thinks that's wrong. It used to be that Social Security payroll tax covered about 90% of wages. Right now, it's been reduced to 82 or 83% of wages. Why? Because high wage earners have made so much money in the last 10, 12 years that that number has been reduced. We have not taken a position on the wage cap, raising the wage cap, but there are a lot of ways that could be done that will protect middle-class American workers. It could stop at 106.8 as now, and maybe start again at another figure, 250, 300, and it could be a different percentage, but all of that would bring revenue into the program.
What about means testing Medicare?
Well, some of Medicare is already means tested. You know, the problem, it sounds easy. People that have more resources should pay more out of their pockets. But if you means test either Social Security or Medicare, you cannot get enough savings out of millionaires paying the full freight, for example, of their Medicare premiums. You have to go down pretty far down to someone who has income of $45,000, $55,000, $60,000 a year in order to really save any money and put money into the program. And I don't think the American people are ready for that.
Let me go back to Social Security with this tweet from Bill. He says, Social Security should be exposed as the greatest Ponzi scheme in U.S. history. Funds non-existent as revenue sources gone. I think you touched on this a little bit before, but go ahead and respond.
Well, unfortunately, we have, as a second largest senior group in the country with 3.5 million members and supporters, we've got our work cut out for us, because that is a myth that has been perpetuated over time, and unfortunately people have bought into that myth, that there's no money there, it's a Ponzi scheme, we'll never get our money. if we're younger workers, and that's wrong. I'm not saying this. The trustees of the Social Security program are saying this. This year, I think this is really important. This year they issued their report. They do every year. The solvency date went down a year from 2037 to 2036. They're saying without any changes, which is not our position, without any changes in law whatsoever, Social Security will be able to pay everybody all of their benefits until the year 2036. After that point, there will be a reduction in benefits of about 20%. That's the gap. That needs to be addressed. Doesn't need to be addressed at the White House on Thursday or before August 2nd. It needs to be addressed in a thoughtful way, as has been done in the past. But how is the program celebrated its 75th birthday, Social Security, last August. There were a lot of birthday parties around the country, and I ate a lot of cake. But how is a program that has paid everybody that's ever been entitled to benefits for 75 years and will pay future beneficiaries every penny they're entitled to until the year 2036. That's what the trustees say. How is that a Ponzi scheme? Most programs in government, I worked on Capitol Hill for many years in the House and the Senate. Most programs in government come back to the Congress before the year's over because they've run out of money. Social Security has never run out of money. It is the most efficient government program I think we have. The administrative cost of running this whole program, tens of thousands of employees all over the country. If you need to go into a Social Security office, no matter practically where you live, you can drive to one. All of those costs, cost of sending out the checks, paid for out of the program, by the way, not out of general revenues, out of the program, 0.9%. This is a darn efficient program, just the opposite of what some would characterize as a Ponzi scheme.
Max Richtman heads up the National Committee to Preserve Social Security and Medicare, referred to a meeting at the White House Thursday with President Obama, Vice President Biden. They've invited the negotiators over this debt talk package to the White House on Thursday. And, of course, part of that debate is whether or not to include Medicare cuts, and as our guest informed us today, possibly a reform to Social Security program as well. Tax increases is also part of the conversation. We'll turn to that here in about 10 minutes with our next guest. But first, Jeff is an independent in Lakeway, Texas. Go ahead.
Yes, I'm 52 and was on disability, Social Security disability, and Medicare. I worked construction all my life and paid in. And so the point is I'm not like at the death's door, as the previous caller said. I'm still viable. It's just I have some messed up knees and a messed up back. So I'm enrolling in fall classes to try to do something else that doesn't require me to climb high rises and do ironwork like I used to.
Okay, Jeff, we're running out of time. What's your question or comment for our guest?
That was just basically my comment that there's some people out here that actually need these programs, and I paid in, so I don't know what we're going to do about it.
All right.
Can I make a comment? We haven't really talked about Medicaid. Yes, we are the National Committee to Preserve Social Security and Medicare, but we have a deep and abiding concern about the Medicaid program. 62% of Medicaid funds go to nursing homes for seniors and the disabled. Seniors need to be aware that that Medicaid, whether it's the block granting under Chairman Ryan's plan or dramatic reductions in Medicaid, those are going to affect seniors at some point, if not today. At some point, the average cost of a nursing home care, I think, is $65 or $70, between $65,000 and $70,000 a year. A lot of middle-class senior families will not be able to continue with that kind of expenditure for very long, and they're going to need the Medicaid program. So we're very mindful of changes to the Medicaid program and how it would impact seniors and the disabled.